Hello viewers, my name is Ian Kimaru. I'm a registered clinical officer. I did my diploma in clinical medicine and surgery at Nairobi KMTC and finished in 2019. Then after that, joined my internship at Machakos Level 5 Hospital since 2020 May and finished in 2021. Then after that went to Kiambu County where I did work with different facilities for 1 year and 2 months. And then after that went to Nyeri County, worked with a private facility for 6 months and currently working with AVA Nurse. I also did some relevant short courses here and there. I have a certificate in basic life support and other relevant certificates. And today basically we want to talk about home care nursing, which is part of AVA Nurse under the company AVA Medicare. So what is home care? Home care is a multidisciplinary or a multi-agency healthcare provision at the comfort of a patient's home or environment with the aim to achieve cost effectiveness and quick healing. So I'll start with the history of how home care started. In 1813, a group of ladies called the Ladies Benevolent Society began efforts to provide home care services by visiting the sick poor and helping them to obtain medicines and supplies and nurses. But these nurses were untrained. While in the north, women from wealthy families began the same efforts, but this was to create friendships with the poor. So they began visiting the sick poor too, but realized that friendships was not helping in combating diseases and preventing infectious diseases among the sick. They also realized that trained nurses were needed, and they began hiring trained nurses for the sick poor and were calling them visiting nurses. By 1875, a nursing association was created with the name Nursing Association for provision of trained nurses for the sick poor. The organization trained, organized and created standards for the district nurses who used a similar curriculum to the one in USA for the visiting nurses. By 1890, there were 21 registered visiting nurses associations in America, and demand started to grow, and also the scope of healthcare provision grew, and they started providing care for preventative measures, that is like vaccines for babies, and also demand grew that they started providing care for chronic patients. In 1909, policy insurance companies and policy providers started sending visiting nurses to policy holders who had chronic conditions. This was trying to limit death benefits claims by reducing the numbers of policy holders who died from chronic conditions. One of the insurance companies that used this model was the Metropolitan Life Insurance Company, which was also the first insurance company to provide reimbursement for home care nursing services, and is also credited for defining the public health nursing through a lady called Lilian Wald, who was a nurse. Apart from defining the public health nursing, Lilian Wald is also credited for establishing the Henley Street settlement, and she worked with nurses who also provided social support, and with time grew and established other settlement houses for healthcare provision, and started training the society in things like carpentry, tailoring, among other helpful skills. By the time Lilian Wald was retiring, her nurses were already visiting 100,000 patients in their homes. Most visiting nurses and visiting nurses associations and societies began to shut down due to economic instability and shortage of nurses from the World War II. And again, by the late 1950s and 1960s, it was so clear that there was a need for home care services. People with chronic illnesses did not necessarily need to be hospitalized, and also effects on lengthy hospitalizations had started to be studied. It was not until in 1965 when USA incorporated Medicare as part of their federal health insurance program, and it was also incorporated into other medical schemes in different insurances. So in conclusion, even basing it from the history, you can easily tell that insurance companies were trying to use the Medicare system as part of lowering their costs on reimbursing death benefits by trying to reduce the numbers of mortality by sending visiting nurses. This is basically achievable by the patient to healthcare provider ratio, where in a home care setup and a single patient has access to multiple teams at the comfort of their home and at the comfort of time.